Can you prevent seroma formation after surgery? Have you ever wondered if it is possible to stop seromas from forming after surgery? This is a common concern for many patients. A seroma is a pocket of fluid that can build up under the skin at the site of a surgical procedure. It often happens when there is space left behind after tissue removal. Understanding how seromas form is the first step. They typically occur in areas where large amounts of tissue have been removed, like during mastectomies or lymph node surgeries. The fluid collects in what is known as dead space. Now, let's look at ways to help reduce the risk of seroma formation. One effective method is the use of drains. Surgeons often place closed suction drains in the surgical area for a few days. These drains help remove fluid that would otherwise accumulate and lead to a seroma. Another technique involves reducing the dead space during surgery. Surgeons may stitch skin flaps down to the underlying tissue or use tissue adhesives to close off spaces. This minimizes the area where fluid can gather. Compression is also a helpful strategy. Wearing tight bandages, compression garments, or specially designed brass can help press the tissues together. Patients are usually advised to wear these for at least 2 weeks after surgery. This pressure can significantly reduce fluid buildup. Gentle massage of the area may also be beneficial after the initial healing phase. This can help move fluid out and prevent it from accumulating. Wound care is essential as well. Keeping the surgical site clean and protected lowers the risk of infection, which can worsen or contribute to seroma formation. Managing activity is another important factor. Sometimes, limiting certain movements or temporarily immobilizing the area can help reduce fluid accumulation. It is vital to follow your surgeon's instructions closely regarding dressings, drains, compression garments, and activity restrictions. These guidelines are designed to help prevent seromas. While these measures can lower the risk, it is still possible for seromas to develop. If a seroma does occur, it may need to be drained or treated in some way. Patients should keep an eye on the surgical site for any swelling, fluid buildup, or signs of infection. Reporting any concerns to a healthcare provider promptly is always a good idea. In summary, preventing seromas involves careful management of the surgical wound environment. By minimizing dead space, using drains, applying compression, maintaining hygiene, and following post-operative care instructions, patients can significantly reduce their risk of seroma formation.